Welcome back to TV5 News at 9. This morning we're talking about your health, specifically brain tumors. We have board-certified neurosurgeon Dr. Jagannathan. And doctor, thank you so much for being here. How are you today?
Morning, Blake. Thanks for having me.
Yes, absolutely. Glad to have you. So, doctor, just even thinking about possibly having a brain tumor can be a terrifying thought. Can you explain a bit what brain tumors are as a general rule?
So, brain tumors are basically cells within the brain or around the brain that grow in an uncontrolled or unchecked fashion. Most tumors are benign tumors, which basically mean that they're not necessarily cancerous tumors. And most commonly, these tumors cause symptoms either by growth, meaning that they cause pressure on parts of the brain that are otherwise not intended to have pressure on them, or they cause symptoms by causing secreting of hormones and things like that are abnormal. There are malignant tumors as well that are tumors that can grow much more quickly and can even spread to other parts of the brain, and those are oftentimes even more serious to manage.
All right. Well, thank you. So how are tumors diagnosed?
So the symptoms of tumors can be extremely vague, and it really depends on the area of the brain that's involved. This can be things like headaches, nausea, vomiting. In some cases, tumors involving the pituitary gland can cause dysfunction involving hormones in the body, such as weight gain. So typically, the first treatment is usually an MRI scan to diagnose the tumor itself. A lot of times, particularly in endocrine tumors, you also look at tumors. You also look at hormone levels and things like that to see if they're normal. And in some cases, tumors may spread from other parts of the body. And in those cases, a survey of the whole body, such as a CT of the chest, abdomen, and pelvis, may be needed to kind of see where the source of the tumor is.
Okay, good to know. And so, Dr. J, you went through some types of brain tumors already. What are the most common that people face?
So probably the most common type of tumor is a benign tumor known as a meningioma. I mean, these are slow-growing tumors that cause pressure, and oftentimes patients notice it because they cause pressure in specific parts of the brain, resulting in headaches. In severe cases, they can cause weakness and other problems as well. Other tumors, such as pituitary tumors, can cause symptoms from hormone secretion. A lot of times, symptoms with these can be visual loss, can be weight gain, breast development, diabetes, things like that.
Yeah.
And finally, unfortunately, the most common type of malignant tumor is the most common, is the most serious, and that's called a glioblastoma, which is an extremely aggressive form of cancer that can spread within the brain and is oftentimes very difficult to control.
So lastly, Dr. J, how can someone decipher whether they should seek treatment or not?
Since the symptoms can be vague, I think any kind of symptoms that are outside of the ordinary warrants medical attention. A lot of the times can be done by seeing your primary doctor, obtaining an MRI scan of the brain. A CT or an MRI usually is a gold standard to diagnose it. CT is a quicker study, which will give you a general idea if something is wrong. An MRI is a more detailed study, which if a CT shows a possible abnormality, a physician may order to try and delineate what's going on. It's important to note that not all tumors are malignant, and a lot of times these can be treated even non-surgically with observation. But it is important, when the symptoms are present, to get this addressed appropriately.
Absolutely. Dr. J, anything else that you want to add before we go?
Nope, that's it.
All right. We appreciate you. Thank you for joining us again here this morning.
Thank you very much.
Absolutely. If you'd like more information or knowledge on this topic, you can find it in the hot links section of WNEM.com.